COVID-19, Part 3. Who is at risk? Hello residents of New Columbia, my name is Bao and I'm a third-year nursing student from UP. As we have the honor to be working with your community this semester, please feel free to contact us at any time for your questions, comments, or concerns. You can reach us through your resident services or at hfnc.upson@gmail.com. Before we begin the official content of this video, I'd like to bring up some of COVID-19 statistics. Here I have images of hospitalization and death by age and by race or ethnicity. These numbers may be useful to you or interesting for you to know, so I will be including links for them down in the description below. Now, this is our third video in our COVID-19 video series, and we'll be discussing what populations are at risk for COVID-19. First and foremost, everyone can get COVID-19, unless they have already had it before and recovered. But everyone can also spread COVID-19, and there are no exceptions to that. This is why knowing the populations at higher risk for severe illness from COVID-19 is so important. They include older adults and people of any age with the following conditions: cancer, chronic kidney disease, chronic obstructive pulmonary disease, any heart conditions, being immunocompromised or having a weakened immune system from past surgeries or procedures, obesity, sickle cell disease, smoking, or type 2 diabetes. Like we mentioned in part 2 of the COVID series, prevent the spread and protect yourself and those around you by limiting social interactions and contact, washing your hands often, social distancing, cleaning and disinfecting frequently touched surfaces, and avoiding all non-essential travel. You may need to take extra precautions as well if you are a part of these groups or living in these situations. Racial or ethnic minority groups, pregnancy or breastfeeding, people with disabilities, developmental or behavioral disorders, or drug use or substance use disorders, living in a rural community, experiencing homelessness, newly resettled refugee population, nursing home or longer-term care facility, or group home for people with disabilities. If you have pets, there are a few precautions to take as well. I'd like to take note that there are very limited and small amounts of information known about COVID-19 in regard to pets and animals. From what we know right now, the risk of animals spreading and catching COVID-19 is low, but it is still present and very much possible. Treat pets like human family members. Limit their interaction with people outside of the household. If someone in the household becomes sick, isolate them from everyone else, including pets. The CDC has more information about all of these conditions and factors, so please check it out if they apply to you or anyone you know. There are resources available in languages other than English. If you are living with or taking care of someone who may be at higher risk, you may also want to check out the website as well. The CDC always has reliable and up-to-date information about everything COVID-19. As always, I would like to give credit to the CDC for the information I provided in this video. I will link all of these websites and more down below in the description. Please email Christopher at Resident Services to let him know you've watched this video so we can enter you into a raffle to win a prize at the end of the year. Also, if you are a BIPOC family, which means Black, Indigenous, and people of color, if you are a BIPOC family who has been affected by COVID in any way, please reach out to Resident Services and they can help connect you to the resources you need, including potential eligibility for a $400 check through a grant they just received. Thank you for tuning in, and we'll see you next time.